Start by making an opening facing towards you. Remove the package carefully, find the top corner and open it away from you. Do not handle within more than 1 inch of the margin inside the tray. Then follow along with the folds and the corners. You will want to maintain a 1 inch or 2.5 centimeter border around the sterile field. Anything inside this field is sterile, anything outside of it is considered unsterile. If it is contaminated, it should not be used on a patient. You may rest the tips of sterile instruments inside of this field. Using the blue forceps provided that start on the outside of the kit, use this to handle the sterile objects inside and set up your tray. Use these to pick up the forceps and rest them on the outer margins of the sterile field. You may use the included garbage bag provided. You want to avoid reaching across your sterile field once set up. Carefully pour your saline without making contact with the tray, and carefully pouring from the side. Other important considerations are hand hygiene, whether using hand sanitizer or washing your hands, as well as ensuring that the work surface is above waist height and sanitized appropriately before using. Equipment for this procedure, of course, would be the sterile tray itself, sterile gloves as required, and normal saline, 2x2 gauze, and sterile scissors as needed. There may be instances where you need to set up an additional sterile field outside of the actual containment itself. Using the tweezers, you may pick this up out of your tray, and then carefully, by only handling the outside 1 inch margins, you may use your hands or forceps to spread this open and then place into a surface to create a larger sterile surface working environment. If additional supplies such as gauze are needed, use the peel and drop technique without contaminating your sterile field. Once your sterile field is set up, you should not leave it unattended or turn your back. There's no way to know when you leave if someone may have come by and contaminated your field, which would cause potential infection to your patient. Once your field is set up, it should not leave your site at any point. Depending on the procedure, sterile gloves may be required. If the context requires all microorganisms and spores to be absent, sterile technique and sterile gloves are required. If the goal is to prevent contamination and minimize the number of pathogens, aseptic technique practices are used, and standard non-sterile nitrile gloves may be used instead. Be sure to open any packaging or containers needed before donning sterile gloves, because once they are on, you may not handle anything that is non-sterile. Place the glove package near work area. Remove outer glove package wrapper by carefully separating and peeling apart sides. Grasp inner package and lay on clean, dry, flat surface at waist level. Open package. Identify right and left glove. Each glove has a cuff approximately 5 centimeters or 2 inches wide. With thumb and first 2 fingers of non-dominant hand, grasp glove for dominant hand by touching only inside surface of cuff. Inner edge of cuff will lie against the skin and thus is not sterile. Carefully pull over dominant hand, leaving a cuff and being sure that cuff does not roll up wrist. Be sure that thumb and fingers are in proper spaces. If outer surface of glove touches hand or wrist, it is contaminated. With gloved hand, slip fingers underneath cuff of second glove. Carefully pull second glove over fingers of non-dominant hand. After second glove is on, interlock hands together and hold away from body above waist level until beginning procedure. Once your gloves are on, you may handle things that are sterile inside of your sterile field. You must be careful not to contaminate your sterile gloves by reaching outside of your sterile field, such as reaching for an instrument that's sitting outside the margin. If you do this, your gloves are considered contaminated and you must discard them. To clean up your tray, while still wearing gloves as needed, remove the sharp metal tweezers and tuck everything into the center of the tray and fold it together to reduce any possibility of spilling, and then place into the appropriate garbage can or biohazard container. Place any sharps or metal forceps into the appropriate sharps container. To discard your gloves, you may roll them inside out, starting with one hand and then the other, pulling one glove into the other one to make a nice neat ball. You may then gather everything into your sterile field, gather it together and discard into the trash, and then sanitize your hands and sanitize the workspace.